Unfortunately, the ER is often the site where we can observe the failures of the rest of the system. And the main one being we are lacking personnel.
Montreal emergency rooms are overcrowded, and it's only going to get worse, according to one emergency care physician. The ongoing staff shortage and poor working conditions in the entire healthcare network are being blamed.
We're missing personnel everywhere. So when you look at the data, the provincial data, you see that the wait times for and the demands for long-term care, for primary care, for rehab centers, for long-term care facilities like hébergement for certain types of patients, those demands and those needs are increasing, and we cannot match it.
Alarmingly high emergency room occupancy rates across Montreal are causing many ERs to operate at nearly 150%. The Royal Victoria Hospital at 152%, Montreal General at 132%, and the Jewish General Hospital at 130% on Sunday. Some recommending to avoid visiting the ER if it isn't an emergency. Call 811.
When you're overcrowded on a chronic basis, you just become, overloaded, and you cannot give the care patients deserve. Some of them end up leaving. We see patients leaving without being seen, increasing because they get fed up. But maybe they need to get assessed and be seen by a doctor. And what we've been saying also is that when you're overcrowded on a regular basis, it's dangerous for patients because patient care is altered. Imagine you have to take care of twice the number of patients that you would normally do. Well, you're bound to make, some mistakes. You're bound to forget a few things. You're bound to not be able to spend enough time with each patient.
According to Quebec's Ministry of Health and Social Services, there were about 59,600 employees absent from the health network as of last month, 10% more than at the same time last year.
The past 2 years, we've seen people leave because of being overworked, because of all the stress related to the environment, people leaving for retirement early, and because of the work conditions were, let's say, not optimal. So we need to reestablish that, get better work conditions.
With COVID-19 still rampant in Quebec, doctors worry the increase in cases in the past few weeks will lead to more people coming to the ER, with experts saying getting the third and fourth dose of the COVID-19 vaccine is still one of the most important ways to prevent severe infection, clearing up space in hospitals for those who need it.
We're hoping that there's not going to be a lot of hospitalization required because, frankly, the system just doesn't have the capacity to handle them, or it's going to have to cut elsewhere.
In Montreal, Brittany Enriquez, City News.